Hi, my name is Dr. Halim Jaffer. Today we are continuing on the glossary of periodontology. We reached the letter B. We discussed some letters, and today we are discussing some others. Please subscribe to my channel, HR Talent, to get more videos on this subject. So, starting from the term biopsy. Biopsy is the removal and examination, usually microscopic, of tissues for purpose of establishing a histopathological diagnosis. May also refer to the tissue specimen obtained by this procedure. So it is not a treatment, it's just examination and removal. So we have some types of biopsy. We have aspiration biopsy. It is the aspiration of fluid through a needle for the purpose of establishing the diagnosis. We have excisional biopsy. It's the removal of the entire lesion, including a significant margin of the contiguous normal appearing tissue for microscopic examination and diagnosis. But incisional biopsy, it's a removal of selected portion of the lesion, and if possible, adjust a normal appearing tissue for microscopic examination and diagnosis. So this is biopsy. The term bisphosphonate. These are bone-seeking agents that inhibit bone resorption by disrupting osteoclast activity. We know that there is a process of remodeling. There is bone resorption and bone formation. As much as the bone formation is important, also bone resorption is important in the process of apoptosis. While some dead cells should be gone and the new cells should be formed. So this process needs an equilibrium. But with the presence of bisphosphonate, there will be an inactivation of the osteoclast, which makes the bone growth happen continuously without rupture. The term black triangle, it's a cosmetic term with the periodontist while doing a surgical operation for or doing some procedures for hiding the black holes, which are the interdental recession manifest as more or less pronounced empty space between the teeth. We name it a black hole or black triangle. These are an aesthetic issue. Takes the concern of some patients that should be treated, and there is a various way, surgical and non-surgical. We have the term basal bone. The basal bone is the only bone that remains while you are getting old. If all of the mandible resorb, the basal bone will remain. So it is the bone of the mandible and maxilla, exclusive of the alveolar process. It's the end part of both jaws, the mandible and maxilla. Bundle bone, it's a type of alveolar bone, so called because of the bundle pattern caused by the continuation of the principal sharpish fibers into it. For example, this is dentin and this is cementum, and these are periodontal ligaments, while here we have alveolar bone. And through insertion of these ends of periodontal ligaments, which named sharpish fibers, part of it in this bone and part of it in the cementum, you see that there is a bundle-like shape of bone. So it's more calcified here, and it's restricted to the alveolar bone proper. The last term we have three terms: cancellous bone, compact bone, and cortical bone. The cancellous bone, other name is a spongy bone, as you see it here. The bone having a reticular, spongy or lattice-like structure. While compact bone, the bone substance that's dense and hard. This is the compact bone. While cortical bone is the compact bone at the surface of any given bone. Any bone you take it, the surface of the bone, of the compact bone, the surface is named cortical bone. So if we have cancellous bone and we have cortical bone, the surface of this compact bone is named cortical bone. So we name it sometimes cortical plate. And this is the terms for today. I hope you enjoy it. Please follow me on YouTube, and thank you for your listening.